7:02.
The Big Interview
With Bongani Bingwa.
18 after 7. Listen to this now. More than 225 people die every day from heart disease in South Africa. It's now one of the top causes of death in the country. And we know emergency rooms in Johannesburg are often overwhelmed. Thousands of cardiovascular cases flood in as the system groans under pressure. We've only got about 200 cardiologists for over 60 million people in this country. That's just 3.3 per million. As I say, heart disease is now one of the top causes of death in the country. But there may be a lifeline, because as you know, even if we could employ more cardiologists, there's often no budget to pay those we would employ. So could artificial intelligence be the game changer? We've invited Dr. David Jankelow, who is a clinical cardiologist, to help explain the extent of the problem and what the opportunities are. A very good morning to you, and thank you so much for your time. Welcome to our program.
Thank you very much, Bongani, and good morning to all your listeners. Please just call me David. It's easier.
All right, David. Thank you so much. Look, our heart disease burden is growing. Could we even call it a crisis?
No, I think we can call it a pandemic or a tsunami. Cardiovascular disease is the biggest killer in the world. And it kills, as you said, approximately 215 to 230 people every single day in this country. And most of the deaths in the world due to cardiovascular disease are and will be occurring in the developing world. I liked your intro, what you said, that there's a paucity of expertise. In 2016, we as an association under Professor Karen Sleever published a paper on specialist cardiac and cardiac surgical training. And at the time, there were 200 cardiologists for 52 million South Africans, one per 260,000. Now, if you compare us to other countries, so just think of some of the other BRIC countries. Brazil has 8,000 cardiologists for 185 million. And that's a ratio of 1 per 23,000, 10 times more than what we have in this country.
Wow.
And even that ratio might not be enough to meet the coming challenges. And my big interest, I'm a clinical cardiologist, is in disruptive technologies and particularly artificial intelligence. And the dream for me is that perhaps leveraging technology in our beautiful country could help democratize healthcare. We have remote, underserved areas where there's no doctors, nursing staff, ECG machines. So that's the dream for me. It's an augment to expertise, and that's what I would hope for.
We'll come to the technology in just a moment, but still to paint the picture, I mean, as I would imagine, given the ratios you've just described there comparatively, it might mean that with too few specialists, our hospitals will likely be overwhelmed. I imagine that might mean longer waits, longer queues. Often I imagine, Dr. David, diagnoses are missed. Certainly doctors will be overworked. Is that how it plays out?
Possibly, but we just won't. At the current rate of producing specialists and cardiovascular specialists, we won't have the expertise to meet the challenges. But so, so this is just some other possibility to help our country and meet the needs, especially in underserved areas in Africa and South Africa. So I think you're right what you say.
This was something that, I don't know, when I was growing up, certainly was associated with older folk. I mean, you had to be sort of over 40 to be dealing with some of these lifestyle diseases that lead to heart issues. But now, are we seeing younger patients in their 20s, even, around there, being affected with things like diabetes and high blood pressure?
We are. Well, I just want to tell you an aside what is our big project under the South African Heart Association today. This is in collaboration with World Heart Day, which is under the World Heart Federation, which is to remind the world that heart disease is the biggest killer in the world and people need to be screened for risk factors. So our huge team, and we all off to the Soweto taxi rank today, where we're going to use a novel AI technology to screen hopefully up to 1,000 taxi drivers and commuters. Because if you think of the taxi industry, there's 240,000 taxis in this country. They move approximately 17 million people every single day. They have high stress, long hours, poor lifestyles, sedentary, lack of exercise, bad diet, smoking, obesity, hypertension, and diabetes. And we did this last year in September at the Rosebank Taxi Rank, but today is our big screening next to Baragwanath. And we are using a novel AI technology to do the screening, but we're actually linking with a second AI technology, which is taking a questionnaire about their lifestyles and their physical habits, exercise habits, and their motivations to stay healthy, but combining that with their vital screenings to create a genre of music in a language which you would know, Maskandi, which is songs that the taxi drivers listen during the long days on the road. And each taxi driver today will create a personalized song with a positive heart health message. And we want the taxi drivers to spread the word amongst their communities.
South Africa,
what we will do. Yeah.
So if I can come in there, South Africa has long been a place of innovation when it comes to heart disease. I don't need to remind you about Dr. Chris Barnard. How could AI be a game changer? We don't, as we've discussed, we don't have enough specialists. We probably don't have the money to pay them, even if we could find them. How could AI be a game changer? And explain this, innovative AI technology you are using today.
Okay, so the AI technology is standing in front of, on a platform in front of a camera, just by a single selfie will measure pulse, blood pressure, and body mass index. We'll use point-of-care testing to do random cholesterol and glucose. But maybe I can, just apart from this technology, give you some other tidbits about this. I'm involved with the Mayo Clinic in the US, which has a massive cardiovascular AI team, and they have developed an algorithm, which is an AI-enabled ECG, which can predict future disease before it becomes clinically manifest. And it can predict heart failure, it can predict irregular heart rhythms such as atrial fibrillation when patients are actually in normal rhythm. And atrial fibrillation is the biggest cause of stroke worldwide. And it can predict valvular heart disease. And my role in this country is to roll out a national project using this technology to screen for valvular heart disease. We're almost there, just a few snags with the protocol and before we actually get going. So we have underserved areas, as I said, where there's no doctors, nursing staff, or ECG machines. And it's an augment to actually screen people and to determine who needs to be referred to a specialist or not. But there's lots and lots of other examples. The other thing is that artificial intelligence is not about replacing doctors. It's about augmenting expertise. It doesn't replace human intuition, judgment, a gut feel about the patient, and also artificial intelligence can't replace empathy and caring. Only human physicians can provide that. But hopefully these disruptive technologies will help free us up from repetitive, redundant tasks. And if it can help us do that, we could just get back to the task, which is our main aim, our main ethos in medicine is to help the patient, to care for the patient.
So we, in a sense, because of the challenges we face, we maybe have a unique opportunity to set the pace, if you will, in terms of how heart disease is treated with technology. Well, good luck to you. And maybe we'll touch back with you in the next day or so to find out how the rollout went in Soweto today at Chris Hani Baragwanath at that taxi rank. And hopefully the associations and everybody involved will be on board. Cardiologist and, of course, talking to us there, Dr. David, he wants me to just call him as simply as that, president of South Africa's Cardiology Association.
Current events, developing stories,
Tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.